My name is Amy Vickers, and I am focusing my attention on the rural and small towns across America and the health disparities they face. Common boundaries to easy access include their geographic location in relation to hospitals and clinics, as well as their income level as a whole. The geographic maldistribution of physicians plays a large role in patient access. Certain predisposing characteristics, such as increased tobacco and alcohol use among rural areas, also complicates healthcare when preventative measures are not being taken. This GIS map is a simple visual aid from which many conclusions can be drawn. The base map displays the state's population concentration. The darker the color, the higher the percentage of people who live in an urban area. The red crosses and purple circles represent hospitals and skilled nursing facilities respectively, in which the larger the size of the symbol, the more beds in that facility. Notice how the facilities are concentrated in areas of higher population, and the lower populated areas are nearly barren. Imagine how far some people have to drive to get to a hospital for a medical emergency, or how long they would have to wait for an ambulance. Also, those are the very people who are less likely to keep up with routine preventative care due to the distance. I thought seeing the map of Florida would be interesting because I'm from Panama City, which is in northwest Florida. The surrounding areas in the Panhandle definitely suffer from maldistribution of physicians. I can see how the opportunities are much different for citizens of Gainesville. In fact, the entire nation follows the same trend, and rural communities nationwide are faced with geographic barriers to healthcare access. This next map displays all of the critical access hospitals in the United States. As you can see, the distribution seems backwards from the previous map of Florida. Rural hospitals have been closing and disappearing in the 1980s and 1990s, leaving rural areas without any health care centers. The 1997 Balanced Budget Act gave a number of rural hospitals across the U.S. the notation of Critical Access Hospital and helped them stay in business to care for rural citizens. Critical access hospitals have 25 or fewer inpatient beds and must be located more than 35 miles from another hospital. With that information, this map makes much more sense, as these hospitals are placed strategically in lower populated areas without a medical facility. While this initiative has helped with medical emergencies in some rural areas, it has not solved the maldistribution of primary care physicians and other generalists who promote preventative care. There are other factors that contribute to making rural America a medically underserved population. Financial status and stability is a major contributor to healthcare disparities among rural communities. With lower wages, many people also live without health insurance as well, perpetuating the problem. Rural communities are also associated with lower rates of people who obtain a high school diploma or complete a college degree, and higher education is directly correlated with better health outcomes. Social factors contribute to rural health disparities as well. Rural communities smoke cigarettes, chew tobacco, and use alcohol at much higher rates than urban populations. This phenomenon, coupled with low insurance rates, low wages, and a long drive to the doctor, is a big reason why rural communities have subpar healthcare outcomes when compared to urban areas. Additionally, even when there is a critical access hospital or clinic available to rural citizens, studies show that the level of care received is below that of larger hospitals. The reason being is that rural physicians typically do not work closely with many other physicians, so there is little opportunity for them to learn from each other and seek professional advice. Also, rural physicians are not exposed to as many cases as urban physicians are, and there is a higher probability of missing the presentation of more uncommon conditions and diseases. The University of Texas completed a study regarding the detection of breast cancer in rural versus urban areas, and they found that rural residents, on average, are diagnosed with breast cancer at a later stage than urban residents. This is mostly due to the lack of routine screenings and preventative care in rural areas. Lack of health insurance would be another factor in missed screenings. Other chronic diseases such as diabetes and heart disease are also more likely to be poorly maintained as well. We are going to wrap it up with some discussion questions, the first of which being, aside from critical access hospitals and knowing the barriers rural communities face, how else could better healthcare outcomes be achieved? Secondly, do rural areas have similar health disparities as inner city areas? What aspects affect both groups of people? Thank you for listening.